A palliative approach to care for the elderly in Nova Scotia. What are the gaps and how do we fill them? This is an informative video for healthcare providers. What is the palliative care approach? A palliative care approach makes palliative care available to patients and families at appropriate times throughout an individual's illness, in order to provide patients and families with a greater sense of control. The approach should focus on the individual and family and on improving quality of life throughout the course of their illness, not just at end of life. It encourages autonomy and the individual's right to be actively involved in his or her own care. The palliative care approach provides individuals with the opportunity to talk about their illness and their goals of care. Information regarding palliative care should be provided to patients as early on as possible, in order to allow them to make evidence-informed decisions after the diagnosis of a chronic or life-altering illness. How is the palliative approach to care involved in a person's illness? After diagnosis and in the early stages of illness, the palliative care approach should focus on open and sensitive communication about the person's prognosis and illness trajectory, including any changes that may need to be made in their lives. Advanced care planning, including discussing the range of treatments available and setting goals of care. Psychosocial and spiritual support to help individuals and families struggling with any issues related to the illness, and any pain and symptom management that may be required. In later stages of the illness, a palliative care approach should focus on reviewing the person's goals of care and adjusting care strategies to reflect any changes in those goals, ongoing psychosocial support for individuals and families, pain and symptom management, and, if and when to engage specialized palliative care providers for issues such as complex symptom management, conflict over goals of care, and family distress. The framework for integrated palliative care enables the vision that all Nova Scotians can access integrated, culturally competent, quality palliative care in a setting of their choice. The Palliative Care Action Plan in Nova Scotia emphasizes 4 pillars that must be considered when implementing palliative care. These pillars are integrated service delivery, accountability, family and caregivers, and capacity building and practice change. All of these areas require continual modification in order to provide the most optimal palliative care to residents of Nova Scotia. There are 2 key benefits to maintaining a palliative approach to care for the elderly population in Nova Scotia. A palliative care approach gives individuals and their families information and opportunities to be more engaged in care and decision-making throughout the illness trajectory. The open conversations that are part of a palliative care approach can help people address emotional or spiritual concerns. They can also help with goal setting and advanced care planning, so as the illness progresses, individuals and families can make care decisions that reflect their personal desires and goals. Additionally, this approach provides better quality of life, greater longevity, and fewer hospitalizations. This promotes family and patient satisfaction, as values can be incorporated into care planning and symptoms can be managed more prophylactically. Therefore, there is less caregiver burden, appropriate referrals, and less futile interventions. The challenges associated with implementation of a palliative approach to care in the elderly are the capacity of primary care practitioners. As patients navigate the healthcare system, different practitioners may not have the same education or model of care, preventing adequate access to holistic palliative care throughout all treatment. Patient reluctance. When clients are not provided with clear and correct information about a palliative approach, they are often reluctant to initiate intervention as they fear the hastening of the end of their life. Social support, advanced care planning, and effective pain and symptom management involved in a palliative care approach is lacking in many individuals' care plans. Often the initiation of palliative care services is delayed until death is imminent, leading to delays in conversations about disease progression and treatment versus comfort care options. We can fill these gaps through policy and protocol development, health professional education, the use of collaborative care plans, and implementing family-centered care. Thank you for listening.